Phase 1 orthodontics, or early interceptive orthodontics, also known as pre-orthodontics. This is an early stage of orthodontic treatment that involves appliance therapy before a child has all of his or her permanent teeth. This therapy is used to improve jaw development to create room for crowded teeth and begin the correction of an overbite or an underbite. This usually takes place between the ages of 6 to 10 and takes 8 to 12 months to complete. We monitor jaw and tooth movement at appointments every 6 to 8 weeks until treatment is completed. Toward the end of treatment, we often place brackets on the top front 6 teeth to help close down any gaps and align the teeth. Every patient and treatment plan is different. Some patients may have a resting period where we will take all appliances and brackets off and allow the patient to grow and develop until all permanent teeth are present. We will monitor the remaining baby teeth every 6 months at normal checkup appointments until the patient is ready for Phase 2 orthodontics or full orthodontic treatment. This is usually around age 12. Some patients do not need a resting period due to their age or how quickly they lose their baby teeth. These patients will convert straight from Phase 1 to Phase 2 orthodontics or full brackets, bands, and wires on all permanent teeth. Potential benefits of Phase 1 treatment: influence jaw growth in a positive manner, improve the width of dental arches, reduce the need to extract permanent teeth, reduce or eliminate the need for jaw surgery, lower the risk of trauma to protruded front teeth, correct harmful oral habits like finger sucking, improve aesthetics and self-esteem, simplify and shorten treatment time for definitive orthodontic treatment or Phase 2, increase stability of final treatment results, reduce likelihood of impacted permanent teeth, improve speech development, improve positions of first molars, guide permanent teeth into more favorable positions, improve lip competence, preserve or gain space for erupting teeth, and improve compliance before their busy teenage years. Today you will be given special toothbrushes, toothpaste, floss threaders, wax, and instructions on how to use all of these items. You can use your normal toothbrush and toothpaste at home, but we will also provide you with an orthodontic toothbrush to make things easier for you. You must brush a minimum of 3 times a day. You may brush more often as well. This means you need a brush in the morning, after lunch, and before bed. You must floss a minimum of 1 time a day. You may also do this more frequently. We will be monitoring your brushing at each appointment. If at any time we feel your oral hygiene is causing harm to your teeth, we will discontinue your treatment early. You can buy a water pick to help flush out any food that can get caught underneath your appliances, brackets, or wires. This is only an aid and does not replace brushing and flossing. Foods to avoid. We are putting a lot of very expensive equipment in your mouth today, and you must take very good care of it to prevent things from breaking. Eating things you are not supposed to is the quickest way to break appliances, brackets, bands, and wires. Keep in mind, if you break or lose any appliances, your parents have to pay for a new one to get made. You cannot have anything too chewy or sticky, so that means no gum, caramel, taffy, or any other sticky treats you can think of. You must avoid things that are hard or crunchy. This includes foods like popcorn, ice, chips, or even a hard pizza crust. You will need to avoid biting into things like corn on the cob, apples, and hard veggies. You can still have these foods by cutting them up into smaller pieces and chewing them with your back teeth. If you have to think twice about if you should or should not have a certain food, then it is probably best to just avoid it. Along with food items, you must not play or chew on things with your appliances, brackets, bands, or wires. You must avoid chewing on items like pens or pencils at school, and if you bite on fingernails, you must stop these habits as well. If you play any sports, please let us know and we will provide an athletic mouthguard for you. If you prefer a different kind of store-bought mouthguard, please bring it in to your next appointment for approval from your doctor. We recommend a mouthguard during all sports with or without braces to help prevent any accidents. Movement of the teeth. Teeth movement is normal and teeth may feel slightly loose while a patient is in any orthodontic treatment. In Phase 1 ortho, patients still have baby teeth, and it is perfectly normal and natural for some of these teeth to be lost due to permanent teeth underneath being ready to erupt in the mouth. We will confirm wiggly baby teeth at your appointments and let you know if it is okay to wiggle them at home. General soreness. It is perfectly normal to have some soreness and discomfort with any orthodontic treatment. You are getting a lot of new hardware in your mouth that you are not used to. Do not get discouraged when you are eating. Just stick to softer foods like pasta, pudding, and mashed potatoes until you get used to chewing with your appliances in. You may take ibuprofen or children's Motrin for a couple of days to help with any discomfort. Please read all packaged instructions based on age and weight when administering any medications. Soreness and discomfort will get better as treatment continues, so hang in there. Sometimes discomfort caused by a wire on your braces can be resolved by moving the wire away from the irritated area with a cotton swab. If the wire will not move, try covering the end of it with a small piece of cotton or a small amount of wax. If the wire is painful, you can cut it with fingernail clippers or small scissors that have been washed and sterilized in alcohol. If you cannot resolve the problem, please feel free to call our office for an appointment. Appliances come in all shapes, sizes, and configurations based on patient need. They can be removable and come in and out, or they can be fixed or glued in place. Patients will be slurpy and slur their words until they get used to talking with the appliances. We recommend reading out loud, singing in the shower, or simply talking around the dinner table to practice. I will show you some examples of the different types of appliances we use and how to work them. Banded Hyrex or Schwartz. These are a type of expander used to shape and broaden the arches to create more space for the teeth and manage jaw size discrepancy. On these appliances, you will see 2 arrows with 1 hole in the middle. These arrows are showing you how to turn the appliances correctly. The key you will be given is for you to place in the middle where this hole is and turn towards the back of the mouth to allow the expander to do what it needs to do. Banded Hyrex or Schwartz. These are a type of expander used to shape and broaden the arches to create more space for the teeth and manage jaw size discrepancy. The Schwartz is an appliance that can come in and out, making it easier for you to turn at home. It will also have an arrow on it showing you the way to turn your key. It will fit inside the hole and turned towards the back of the mouth. Barrel 3-way sagittal. This is also a type of expander. This appliance is used to broaden the top jaw to reduce crowding and is frequently used for patients with a Class 3 malocclusion, more commonly known as an underbite. This appliance will have 3 different spots that you will have to turn. Each of them will also have an arrow on them showing you the direction to turn them. Your key will be placed in the hole and turned back, placed in the hole and turned in, and placed in the hole and turned in. AGS Auricanator. These appliances are used to reposition the lower jaw by bringing it down and forward to help correct a Class 2 malocclusion or overbite. They also help provide room for lower bracketing. If patients close too deeply, they can cover up all lower front teeth, allowing no room for placement of the brackets. We are excited to start this journey with you and look forward to seeing you about once a month. But if you have any questions or concerns in the meantime, feel free to call our office at 660-646-3802.